Hi, this is attorney Mark Thush, where we ask attorneys and doctors from around Central Florida legal and medical questions that can help you. Hi everyone, today's guest is Dr. Nicole Ingrando, a chiropractor with offices in Longwood and Orlando, Florida. Today's question is from Diane, and she asks, about 10 years ago, I was involved in a car accident. I received physical therapy, massage, and chiropractic treatment, which really helped. Recently, however, my symptoms have returned. Is this normal?
That's a great question, and it's a question that we hear almost every day. It is normal, and this happens often. After you undergo treatment and you learn exercises that are designed to prevent spine pain, you can do very, very well, but as you return back to your normal activities of daily life, and as you return back to work functions, lifting functions, and everything that you need to do, your spine will tell you over the course of your lifetime what it needs. Just like a newborn baby crying, trying to tell a parent that he or she needs something, the spine is very, very similar. When you have symptoms or pain, very often this pain does not mean that you're enduring tissue damage, but that your spine needs something. Often you want to make sure that when you are feeling these symptoms return, a doctor is doing an exam to diagnose where this is coming from and to rule out any tissue damage or anything for you to worry about. The next step is to find out where the pain is coming from and find out why. What is perpetuating the pain, and what can you do outside of our office to avoid it?
Okay, well let me ask you this. Will she have to seek medical treatment for the rest of her life?
That is not the goal. Any type of treatment, if the treatment is dictated by the diagnosis, should be very, very effective and relatively quickly. What we look for in a patient undergoing some sort of care, especially a passive therapy for pain like this, is I like to hear my patients say that the pain intensity, duration, frequency is going down, and their functional capacity is going up. It's important to have measurement tools along the way to ensure that we're headed in the right clinical direction, meaning the patient ultimately is pain-free, or their life is not dominated and dictated by the pain.
Okay, so I guess it's fair to say that some injuries never resolve and others may over time.
Of course, and it's variable from patient to patient. What's important to know is that when your spine is hurting or you experience pain, again, it's your body's way of trying to tell you something. So it's important that you're with a professional that can diagnose what the spine is trying to say and find ways to overcome this quickly and to manage the pain as it comes and goes. I can't be everywhere with my patients at any given time, on vacations perhaps, or at work. So I try to make it an important factor to identify the perpetuating factors and educate my patients on what they can do to prevent this pain and what they can do exercise-wise or rehabilitation-wise on their own to avoid the pain from coming back.
Thank you, Dr. Nicole Ingrando, with offices in Longwood and Orlando, Florida. Hey, thanks for coming on our show today.
It's my pleasure, Mark. Thank you for having me.
Hey, I hope you've enjoyed our show today, and remember, I'm a personal injury attorney, so if you or someone you know could use my help, give me a call. I'm glad to help. And don't forget to go to Facebook and like my page. That's Mark Thush, PA, so you can receive free updates on my video posts. I'll see you soon.